Good afternoon, everybody, and welcome to this public accountability meeting at the end of September. We've got quite a full agenda, focusing mostly on coronavirus, the fire rescue services response to that, and the police's response to that. We have got a full list of attendance. Have we got, and we've got, I think, apologies from Jonathan Foster, who's on annual leave. So unless anybody's got anything else they want to add to that, I will proceed. If you want to come into the discussion, can I just ask to do the usual, and that is use the raise your hand function, and I will keep an eye on it down the right hand side of my screen. And if I miss anyone, please do just wave at me to make sure, physically wave at me to make sure that I don't miss you. The minutes of the previous meeting are on the YouTube. People can just go back and have a look at that. Whenever they want to, so the record is in the public domain. So I think I'll take the first substantive item, and that is questions from the public. And we've had a number of questions from the public this month. So I'll start, I think, with Mr. Baldison, whose question is, how many people have been cautioned for not obeying the rules? It seems morally wrong to prosecute when more serious crimes are warned and cautioned. And I think, Lisa, you're going to take that.
Yes, thank you, Julia. So as a police service, as you'll know, we only play a part in this public health crisis. We are working very closely in partnership with local authority partners and health partners. And as a part of that, we use a system called the 4 E's. So not everybody is prosecuted in relation to breaches of the rules, and we adopt an approach where we're trying to prevent the spread of the virus and make sure we look after people's health, protect the health service, make sure that we look after our communities. So we adopt and engage with the community in the first instance to explain to them what the regulations are, what the guidance is, because there's a big difference between guidance and legislation that was passed. Having explained that to them, we then encourage people to follow that guidance or legislation. And it's only as an absolute last resort that we would move to an enforcement outcome for that person, because they absolutely refuse to take advice and are therefore putting other members of the public at risk of spreading the infection and putting our communities at risk. Absolutely understand that there are other offences and crimes that seem to be much worse in comparison, and that there are things called cautions or report for summons available for some of those offences, whereby the legislation that relates to coronavirus, public health legislation and the COVID legislation, the enforcement method is by way of a fixed penalty notice. So there isn't actually a caution available in the same way that there would be for perhaps the investigation of some of the crimes. So to give you an idea, since the very start of lockdown on the 23rd of March, North Yorkshire Police have issued 1,151 fixed penalty notices in total across that period. The vast majority of them were at the very start of the lockdown, when there was an absolute lockdown, and we saw a vast number of people making non-essential journeys away from their home addresses and couldn't be encouraged not to make those non-essential journeys, and were affecting the spread of the virus. Only 5 of those fixed penalty notices have actually been for people refusing to isolate. And again, we would absolutely adopt the 4 E's approach of trying to encourage, engage with, explain to people first. And those notices have only been issued in circumstances where people have refused to abide by the guidance and legislation, and are therefore putting other members of our community and our families at risk.
Thank you, Lisa. That's really helpful. We've now got a series of questions from Philip Allett, which I will answer. So the first one is, could you please provide an update concerning the number of local authorities that have now deployed COVID marshals? In North Yorkshire and the City of York, there has been, none of the local authorities have yet deployed COVID marshals, but we are having discussions, for example, with York around some of the resources they've got in the city centre and as to how we might support them. And we're having wider conversations with each of the local authorities. The issue being that the rates of the virus transmission are very variable from area to area. For example, in the Craven area, you've got higher levels in some of the sort of more urban areas and lower levels in some of the rural areas. So we've got to think quite carefully about how they may be deployed. And we've also obviously got to take into consideration what resources currently exist in those locations that are doing a similar job or could be provided with additional training or resources to, in effect, take on some of the things we might imagine a marshal to do. So those discussions are ongoing and will be concluded in due course. So questions 2, 3 and 4 relate to the deployment of the army in North Yorkshire. And I'm just going to take all of those as a single question, because the army is not going to be deployed in communities in North Yorkshire. I think it's a good question because there was some confusion around all of that at the original announcements, but the army, you will not see the army in North Yorkshire enforcing or doing anything on the front line. However, we have had support from the army behind the scenes, particularly around logistics, which of course the army is particularly skilled at, and that was really quite substantial in the first part of the pandemic, but their role at the moment is minimal. So there won't be any members of the armed forces sworn in by chief constable or anything like that, and whatever role that the army does do will be in the background by way of support. So I think that's, we've got one more question, I think, which came in a little bit later on, which I'm hoping I've got. Yeah, this is quite a long question, so I'll read it out. So it would be interesting to learn factually, both is there and is it professional judgment that there will be a decline in COVID compliance over time, particularly now that it's law, and that parliamentary debate hasn't been applied, and our civil liberties views in a minority, and questions around the consent of parliamentarians. Lisa, do you want to take that question?
Yes, thank you, Julia. I think I would direct the author of the question probably to the internet or other academic research. There's lots and lots of research out there about compliance with legislation and legitimacy and why people do or don't comply with legislation. So I'd probably point you in the direction of some of those research studies because it's quite a complex and broad subject. In terms of legislation and consultation and votes, etc. So from a police perspective, nationally, policing and other agencies are consulted when the government and other agencies are looking at legislation. However, in these circumstances, once legislation is passed, the role of the police service, we swear an oath to uphold the law of this country. We're apolitical and our job is to uphold that law. And to keep the Queen's peace and to protect people from harm and protect property. So I would again advise you that you would have to direct your question towards the government in respect of the methodology of such legislation being passed.
Thank you, Lisa. It might be a good question to put to a local MP in that respect, because obviously they have responsibilities in Parliament. So I think that is all of the public questions. We may get some more as we go through the meeting, and if so, we'll come back to them towards the end of the agenda. The first substantive item is the Fire and Rescue Services response to coronavirus. Phil, are you going to lead on this to start off with?
Yeah, if that's okay, Commissioner. So we've got a number of speakers.
Hang on a minute. Sorry, Tom's just put his hand up. So let me just, before we get into the substance of your response, I apologise for interrupting. Tom, would you just like to come in quickly?
Thanks, Julia. Oh, is my mute? Can you hear me? I'm okay. All right. Sorry, the thing's playing up. I just wanted to come in and just make it clear, because I think there are a few questions, obviously, with the resurgence of the virus at the moment. There are a few questions in terms of what this meeting was really looking at, and what we're pitching here.
Oh, you've gone now, Tom. You've gone onto mute.
Am I back?
Yep.
Right, sorry, I think there's just a massive lag in my system. I don't know what you heard there, but essentially, I just wanted to kind of give a really brief kind of put the emphasis on what we're looking at in this meeting, and this is very much a retrospective look at what happened from March to July. I want to make that clear to the public. We may touch on looking forwards, but this is very much looking at what happened, what lessons we have learned from that period of time, and the way in which the services responded in North Yorkshire, and therefore what we can take from those lessons in terms of how we would run this in the future. We're not going to be discussing the actual nature of what is going to be happening going forwards. This meeting was obviously conceived before the kind of national resurgence kind of started. So I just wanted to make that clear from the off, in case any members of the public wondered why we were only talking about what happened in the past and weren't focusing on what we're going to do now. This is very much about those lessons learned, what went well, even better if next time. So I just wanted to make
that's clear. Thank you, Tom, for that. So Tom, could you just take your hand down as well, please? Sorry. Thanks. Otherwise I'll get very confused. So Phil, over to you. I think you've got Dave, Steve, and Adam with you. Welcome everybody to this meeting. Phil, off you go.
Thank you, Commissioner. Yep. So I'm going to start off by talking about the strategic level of activity that we did as part of the COVID approach. I'll then want to quickly move over to Dave and Steve to talk about the tactical elements and about how we approach that. And then, as you've said, we've got Adam and James from a task-based sort of like level to talk through. So hopefully you'll get a flavour across all three sort of like operational levels as to how we approach the COVID event. So the first slide here really just shows the complexity of our meeting structure. So it was really important for us at the beginning of the COVID phase to put in a meeting structure that would serve us then throughout the COVID phase. And in fact, it is still in place, albeit we will modify it now going forward. So as Tom suggested, this is what we did from March onwards, but we are starting to now modify that structure as we go forward, and I'll explain some of that as I progress. So we held our first business continuity meeting actually on the 6th of March, and derived from that really this structure started to emerge. And as you can probably see down the left hand side of that meeting structure, we've got we've had and continue to have full involvement with North Yorkshire Local Resilience Forum. So at gold level, we've had that involvement through the strategic coordination groups. That then feeds down to the tactical coordination groups at silver level. And you'll see the other silver box there below the TCGs, something called the Multi-Agency Coordination Cell. Now, interestingly, we've recently seconded an officer across into that multi-agency coordination cell, which is really beneficial both for the Local Resilience Forum and obviously for us as a service, because not only do they get somebody dedicated to taking forward some of those work streams, but we can also use that expertise coming back into the service, and that officer will actually be our sort of like expert in terms of COVID related activity. So it's a really good information avenue that we've got there now, and some specialism emerging. So right at the top, obviously, there's the public update meeting, which police and fire feed into to reassure the public as to what actions are taking place. And then beneath that, you'll see that there's the Gold Officers group. So very early on through the crisis, if that's what we're going to call it, the Gold Officers, 4 of us, met morning and night to really keep abreast of what was a dynamically changing situation, so that we could assure ourselves that we were fully informed and then be able to sort of like react and advise accordingly. And across to the right there, again at that strategic level, we did have this interface with North Yorkshire Police and Fire taking place as well. So we've got that collaborative sort of action taking place as well. Coming down from the strategic level there, back into the tactical level, you'll see right in the middle there, there's what we had, what we called our business continuity meeting. Now that was pitched at sort of like the silver level, but a bit of learning now going forward is we're going to move that up into the gold level and make that business continuity meeting a strategic level meeting. And then beneath that, we will have a tactical business continuity meeting. So in terms of setting strategic intent, that's what we'll do at the gold level BCM. That will then feed down into the tactical BCM to then put in the strategic actions into tactical actions, let's say. Now, again, at silver level, what we had going on as well was that interface between North Yorkshire Police and North Yorkshire Fire and Rescue Service, because let's not forget, in between the two is the enabling service for both fire and police. So again, it's making sure that that collaborative approach continues throughout. Then across to the right there, again, in the tactical level, you'll see that there's a North Yorkshire COVID working group where, again, strategic actions were worked through, and then that fed down into some subgroups to, again, put the tactical actions into task-based actions and actually get the work done. And then feeding across to, you'll see there's a specific group there for personal protective equipment, cleanliness and hygiene, given the critical nature of those elements. That was in itself a sub-working group sat aside. So like I say, all of the actual nuts and bolts could be screwed together and get the work done. Importantly, off across to the right hand side there, we've got the assurance process. So everything that we were doing was being assured at every level by the assurance directorate as such. And interestingly, because we wanted more scrutiny around the prevention and protection activity, and to make sure that that was being delivered to the level that we wanted it to do, we put in a specific sort of like assurance piece there for the head of P&P to provide that assurance back to the gold level team that prevention and protection activity was also taking place. Now we did, since obviously recovery and renewal came into operation, we went more to a recovery and renewal phase. We've now reverted back, as Tom's alluded to just previously, we've reverted back to weekly business continuity meetings. That's completely in line now with the local resilience forum and frequency for SCGs and TCGs. And it also links in with the National Fire Chiefs Council frequency of meetings, which have now gone to weekly updates for all chiefs to be involved. So what was emerging then from this meeting structure, and a key piece here really was communication to our staff within fire. And because of the influx, just the volume of information coming in from government and from other avenues, we were actually doing daily communication pieces, which was probably about right at the beginning, but then we quickly realised that people were getting bombarded with daily communications. So what we ended up doing over time was then reducing the frequency of those communications to 3 times a week, but obviously increasing the actual information within each communication. And this was particularly relevant to our on-call staff who can't access communications perhaps as easily as maybe whole-time and day crewed staff. So we sort of like sensed just the importance of reducing them down slightly, but including all the information in less frequent communications. Like I say, that meeting structure's developed over time, so it didn't start out looking like that. But as we progressed through, we took the learning actively and developed the meeting structure to what you can see there. And like I say, the learning now going forward is we'll lift up that business continuity meeting right in the middle there, up to a strategic level, and we'll put another BCM back in at silver level to form that into tactical actions. Can we go forward a slide, please, Dave? Again, there seems to be a slight lag on this. So the next slide, as you can see, whilst it loads up, is very much about our strategic priorities, very much a strength of ours. So at the very beginning, again, it was important for us to set that strategic intent. So organisationally, we knew what our priorities were. And interestingly, those priorities that you can see there, they didn't start out like that. Again, they started out with, I think, 3 or 4 initially, with the main aim to maintain our critical service delivery in terms of our statutory responsibilities, which really, in effect, is our emergency response capability. So very, very sighted on maintaining that critical service delivery element. But equally, we were also sighted on being able to collaborate with partners, support partners, to deliver not only our own prevention and protection sort of activity, but also assist partners in providing service to those who are most vulnerable within our community, I suppose. Now, the strategic priorities all the way through really have been pretty much in line with the National Fire Chief Council's strategic intentions. And again, we've been very, very sighted on, committed to following the national advice coming from government and from NFCC. So throughout, I'm not going to read all of those priorities, and as you can see, they're up there for people to read themselves. But there was very much an importance of us taking the right sort of action as an organisation in terms of minimising the spread of infection, both within our service, but also more importantly, I think, to the community that we're serving. And these priorities certainly sort of like lent themselves towards achieving that. Again, I've mentioned the National Fire Chiefs Council, the NFCC. As part of the national approach, the NFCC worked closely with representative bodies on a national basis and produced what they called a tripartite agreement. And this has had many versions since the outset of COVID phase back in March, and we're up to tripartite agreement number 13 now. And what that served to achieve was, through consultation with the rep bodies, creating a number of additional tasks which the fire service could be more adaptable within to provide, again, a better service to the public nationally. And there's a range of different tasks within that tripart agreement, such as prescription delivery, food delivery, providing ambulance drivers for the Nightingale hospitals, and so on and so forth. And that list of additional activities has increased over time. Now, I'm not going to get into the tactical level. I'm going to leave that to Dave and Steve to explain more about how we've approached that element. But this, from a strategic point of view, was very important that we were sighted on the national perspective and then taking that and applying it to how we would work within North Yorkshire, working closely with the local resilience forum and other partners. I think one more point I'd like to just explain as well in terms of funding for COVID. We have been afforded a grant from government, around about £600,000 actually for COVID related activity, which has really served as well to be able to deliver some of the additional activity that you're going to hear about in a moment. And we're actually sort of like halfway through using up that fund. Now, it's difficult to predict, obviously, at this point, how much of the fund we will use up as we progress towards the end of this financial year. If there's any left as we go, well, hopefully emerge out of COVID, then potentially that might be able to be used to offset any COVID impact on the funding streams that we could expect to receive income from going forward. But again, that's obviously a changing picture as we work through. So hopefully we will emerge out of COVID soon, and we'll be a better place to be able to understand what the funding picture looks like. So I didn't want to sort of like harp on too much about the strategic level. I think it's probably more interesting and more important really to get into the tactical level so the public can have a really good understanding, and yourself, Commissioner, as to exactly what we've been doing. So how these strategic priorities actually work through into, you know, how we actually went about our response to the COVID phase. I noticed that Tom's got his hand up there. So
yeah, Phil, just a minute. I just got Well, Tom, do you want to come in and ask your question? I really want to keep this meeting on track time-wise. So, so Tom, go on.
I'll keep it quick then. I just, it's great to hear about the tripartite agreement and the additional activities that were available. And I think the relationship with the FBU here, and I know Steve's on today, has worked particularly well on that front. I just wanted to ask quickly around BAU and that kind of point for the public. There was a lot of strategic impetus put around maintaining business as usual, and more particularly around the kind of prevention elements. And you know, if this is going to be picked up in the tactical elements of the presentation, then please let's move on. But I just wondered if there was anything from a strategic level around how you had actually factored in all of that work and how you'd intended to try and balance that alongside the coronavirus response that you were giving.
Yeah, and Tom, you quite rightly said that is going to be discussed in a minute by Dave and Stephen. But you've picked up on a very interesting point there, and one that I sort of like accidentally omitted in terms of our relationship with the Fire Brigade Union and the other representative bodies. Having that inclusive sort of approach from the very beginning of the COVID phase has really served us well, and I'm hoping we've got Steve Howley, who's our brigade secretary for the FBU on today, alongside our head of prevention and protection, Dave Winspear. So hopefully you'll get a sense as to how that relationship has really served as well as we've progressed through COVID, in terms of being able to sort of like come up with the solutions collectively, which again links to that strategic approach from an NSCC tripartite agreement sort of like direction as such. But yeah, Dave and Steve will be much better to be able to describe to you the sort of action we've taken in terms of business as usual, as you've discussed there, Tom, and also how we wanted to continue with our prevention and protection activity. So happy to
thank you,
Dave and Steve.
Good afternoon. So Phil's obviously outlined the strategic approach was taken right from the very outset as we moved into lockdown, and he's captured the fact that a number of strategic priorities were formed in the way that he's described. They obviously then fed down into a tactical model, and that was really about how do we go about delivering our work. And Tom's question and the phrase business as usual is quite apt, because it was very apparent in March as we moved into lockdown that carrying on our normal operating model was not going to be the way that we were going to be approaching our service delivery, particularly around prevention and protection. I will come back to that in a moment and just talk a few examples, but on the screen now is a couple of pictures that really capture the approach that we took very early on in risk assessing our work activities, our normal activities, and applied quite a robust risk assessment process to them to determine whether we could, as you can see here, assess and continue. In other words, there had to be no modification, no changes to the work in regards to COVID, or we would assess, adapt, and then continue. So we had to put in some additional control measures, or we would assess them and actually cease the activity just because of the nature of the activity just didn't lend itself to us being able to deliver it in the business as usual format. So there were three options. We call this a 3-point risk assessment, and all of our activities around prevention protection were subjected to this risk assessment based approach. The really important thing I would like to raise here, and I'm really pleased that Steve's with us today, is that we did this very much with the rep bodies, in particular Steve and the FBU, and in leading up to this we created behind the scenes some very good sort of processes that allowed both myself and Steve and the other people involved in the risk assessment, but also staff, to understand very clearly how the process would work. What that allowed us to do was to expedite these assessments, and we managed to get decisions made very quickly with full agreement between sort of myself in charge of head of prevention protection and Steve basically representing the FBU. And it was from the very outset a very, very good model, a very good working relationship, which is still continuing now. We're still in regular contact and dialogue about what we're doing, how we want to make adjustments, and how we want to transition back to, as you call it, business as usual. So the model still stands. It's still being used as a very live tool within service and with the rep bodies. On the right-hand side, you'll see a semicircle, and this was something that was developed between the service and the FBU. I'm just going to ask Steve, actually, do you want to just talk a little bit about how this was brought into being? Because this was something that was quite significant as we got into the lockdown period.
Yeah, I will do, Dave. So as Dave's pointed out, and Phil earlier, that we were very much in the mindset of working together to get over the challenges of COVID. And there were a great number of challenges in that, in terms of everything had to be risk assessed. All normal business had to be risk assessed, and new ways of working introduced for some of that to continue and some to cease. So what we decided we needed was something that was quantifiable in terms of provided service with a real quantifiable way of assessing the risk and what that risk meant to us in North Yorkshire, both firefighters and the public. And that's where we came up with this COVID risk rating. And I won't go into the detail of the numbers and the figures around how that model turns from green to amber to red to black in this, but very sort of on a very simplistic basis. What we did is it's aligned to the real data provided by Public Health England on the COVID risk and emerging cases, etc. And what we have seen is that risk calculator absolutely works, because as we've now seen a heightened sense of COVID cases in North Yorkshire increasing across the county, that our risk assessment calculator actually tipped into the red at the exact same time as when the information from Public Health England was coming through. So what that does is that gives us real assurance that all the risk assessments and the activities and everything that we've based on this calculator is genuinely quantifiable, and it means that our people, both staff and the communities that we serve, are as safe as they possibly can be going forward. So, because as Dave mentioned earlier, it's been not just about keeping our staff safe, but keeping the public safe as well, because firefighters aren't necessarily vulnerable to serious impacts of COVID, but the real vulnerable people that were there to help are. So it was very clear that we needed to make sure that we were minimising that risk of spread to the communities, whilst also being able to maintain service delivery. So therefore we could go about our day-to-day business as well, in terms of keeping people safe from road accidents and fires and other emergencies. So I think does that cover what you needed to cover, Dave, there?
I think so, Steve. Yeah, I mean, I will bear up what you said. It is a model that has proved its worth, and it has helped to inform those decisions that have allowed work to progress and continue. Tom, do you want to come in with a question before I continue?
Yeah, it was just in terms of going forwards then, what have we learned from this process, and how, because obviously things have moved on as we've gone through, and we're in a better situation with PPE now and all of these kind of things. How have we learned the lessons from what happened previously? Because obviously prevention and protection activities really did drop off during the last crisis period. Are we in a position where these risk assessments are now being updated proactively, in terms of making sure that, given the lessons that we've learned from last time and the situation we're in now, as we go forwards, we'll be able to implement those practices and those activities in a better, more effective way?
I mean, very much we've learned how to apply this tool. So this is continually ongoing, and the risk assessments, as it says there, are regularly reevaluated or reviewed. And that's something that I do in conjunction with Steve. Obviously, we're in a changing position right now. We'd actually moved at the end of August, early September, back towards a more normal operating model, but things have changed again, which has had to feed back into this. So currently the service is in red, which actually influences the decisions that we've made around the 3-point risk assessment. Your comment about prevention and protection activities have dramatically reduced. We're going to talk about that in the performance part, but we've diversified. We've had to change, as a result of COVID, our normal operating model. We had to step back from the normal regulatory approach for, say, like fire safety. But we introduced alternative ways of working, which have actually been really quite successful and impactful. So, yeah, we've had to look at where we were able to make adjustments and amendments. We've done that and we've applied that, and I think where we are right now is going into a new state of, I'm not going to say lockdown, but you can see that there are local lockdowns, there are changes on a sort of local area basis coming about. So we're modifying how we can deliver the work to make sure, A, we're doing all things Steve said about keeping our staff safe, the public safe, but delivering on the really essential core aspects of what we're there to do. And some of the activities that we've maintained throughout, the risk critical ones, they will continue as well. So, for example, enforcement activity has never stopped. There just hasn't been demand for it. The same goes for the number of complaints coming in from the public that we would normally react to. They are significantly lower. And we've maintained the safe and well approach as well, which is basically by referral. And you'll see in the performance pack, we can demonstrate how that's happened. So a lot of activity has maintained itself, and in certain times throughout the lockdown period is elevated, and you'll see some spikes. We recognise certain types of work have gone down, but equally we can also demonstrate where we've used the opportunities to do work perhaps we wouldn't normally have done to good effect.
Steve, do you want to come in? We've done 2 slides and we've used half the time, so I'm just trying to move this on a little bit. Steve, do you want to come in, please? That'd be great.
Yeah, just very quickly. I'm just picking up on Tom there in terms of activity reducing. I would actually question that in terms of activity reducing. I think normal activity, how we would see in a normal sense, definitely reduced in that way. However, activity increased to the most vulnerable, and I think what we ensured in the service was that the ones who are most vulnerable from fire and effectively COVID-19 got the best protection possible. We entered into a task where we were, although a lot of it was on the phone, we did calls to the shielding list across North Yorkshire County Council, and firefighters had a massive impact in contacting thousands of people, vulnerable people on that shielding list. So yes, Tom, it may not have looked as business as usual. However, I think one thing that we can be absolutely clear on is that the most vulnerable in our society in North Yorkshire got an increased level of protection from both COVID and fire from the work that we undertook in that respect. And it is, like we said at the beginning, our absolute objective to ensure that all activity is both safe to our staff and the people that we serve.
Yeah. So I'll move on very quickly. I'm conscious of time, but basically what we wanted to sort of illustrate here, and Steve very nicely touched on one significant piece of work, but opportunities presented themselves to us during the lockdown period. We were being very creative and innovative in our own rights, but we managed to in some way access opportunities that we perhaps haven't foreseen, and the shielded list was a really good example of that. Early on, we were approached by the NHS. The Nightingale Hospital in Harrogate was built in an extremely short period of time. We placed specialist staff within that team to oversee the construction phase of that hospital and provided the sort of fire safety advice to the NHS at that time. And then that went on further to look wider about our response and protecting not just the people who may well have been using the hospital, but the sort of wider Harrogate area as well. Lots of other things have happened where we've been able to try and support. The tripartite agreement that Phil touched on earlier on. We basically, Steve and I, were very much in agreement that we could support all the activities that have gone through the various iterations of that agreement. But the demand hasn't been there for us to do that. Now, where we are right now, that agreement still stands. And as we nudge towards more into the autumn period, If we are required to provide additional resources against those arrangements, then we are in a place to do that. And we are in, as Phil said, again, in regular contact with the local resilience forums on what that would be. So I shall pass on to a colleague called Adam now, Adam Farrow.
Adam, you're on mute, I think.
Hello, Adam?
I'll start while I'm trying to join in. And so at this task level, obviously there was an opportunity to then deliver the work. We've gone from the strategic to the tactical. This is about going out and delivering. So again, as we've all been saying, it's about turning decisions into actions, into work on the ground. And that's what basically our staff did. And Steve's talked about a couple of examples there. On here, you can see some examples. We got involved in like making face masks, delivered to local care and NHS establishments, particularly on the East Coast. One of the real success stories that we're really wanting to focus on going forward is youth work. We managed to maintain a lot of our youth engagement programs. Fantastic segue, Adam, if you're ready to just comment on the youth work you've been involved with.
Yes, is that working now? Can you hear me?
Yeah.
Brilliant. Yeah, thank you very much for that, Dave. Apologies for some of the IT issues. Yeah, just want to talk to you a little bit about some of the work that we've done at Northallerton. Other stations have done great work as well, as you can see from some of the pictures there. But two ways that we've really sort of changed the way we worked and the way our task is worked. The way that we talk to schools and the way that we've carried on our fire cadet work. So we've got 16 fire cadets at Northallerton, and they're all doing a BTEC, which is a really valuable sort of educational tool that we can deliver to them. They get a BTEC level 2 out of it, which is fantastic for them. And unfortunately, we had to stop meeting them face to face. So at Northallerton, we came up with a virtual classroom online. And we carried on with that BTEC, and we've continued to carry on with it, delivering that education and that kind of sort of routine for them that they missed out on because of all the schools closing and youth clubs closing. And as you can see there in the middle, there's a chimney fire picture that one of my cadets made, and they delivered that leaflet out to people in their village during the sort of height of COVID lockdown in sort of March and April. So they were able to sort of continue some of our community fire safety work, and that in turn they were able to get credits for from BTEC. They all are willing, you know, they want to come back to the station to carry on with the cadets, and I think they've really enjoyed the fact that we were able to deliver that lesson to them virtually, and not just be another service or another classroom which has had to close. So that was the cadets. Yeah, we spent a lot of time looking after the cadets in our area. We've also spent a lot of time communicating with local schools, and we've done videos for local schools, much like other stations have, providing Q&A sessions and delivering talks on different equipment and what we've been up to during COVID. But one of the main things that we did for the schools was introduce a booklet. I just want to pass you on to my colleague James, who can tell you a little bit more about that.
Hi there. So obviously during the COVID periods, a lot of children were sent home and schools were closed. Because of this, we didn't get to do the fire safety to the children like we would. So I decided to create a booklet as part of our area, which we now share with multiple areas. It can be seen on our social media, and it can be shared by email as well. Is in digital form. The idea of the booklet was, since people were now spending more time at home, they were at a higher risk of fire safety within the home. So there was lots of fire safety advice, lots of little games that they could do as a family, working on different types of escape plans, And it was also just something to keep the kids engaged and working with the parents. So we're still getting that fire safety advice, but also it gives them something to do with home learning around fire safety.
Thank you very much for that. I think we're happy to move on from our side.
Okay, I'll come in now, Commissioner, if that's all right, unless anybody's got any questions.
Yeah, Phil, I do have some questions, if that's all right. So, I mean, that's just a fantastic, great thing to have done, and you know, really appreciate that. I suppose my question is, I mean, you know, some areas, some stations did a lot of work like that, really good stuff. And other areas, there wasn't so much work going on. As we move forward into the next stage of the pandemic, which is an unfortunate forward that we don't want to be in, but we are, how are you going to try and ensure there's more consistency across the patch?
So what I'd like to see happening there, Commissioner, I think what is happening and really encouraging is a lot of the work that you've heard about there has been generated from, you know, local ideas, and it's been really down to their creativity. I suppose assisted in some respects without seizing the opportunity to put technology on the stations to enable them to do that. So that now the video conferencing that Adam and James are talking through was provided at the outset of COVID to really sort of like maximise you know, our capability. But like I say, the creativity that's emerging at different locations, we'd like to be able to share that further afield as well. And it's certainly stuff that Dave can do through the prevention and protection sort of section in terms of taking the learning, taking the best practice and then sharing that wider across the organisation and really demonstrating the effectiveness to our staff and encouraging our staff to get on board. And, you know, arguably some sets of staff will be more willing or able to do that maybe than others, but we do certainly want to see it grow across the organisation, because as we come hopefully out of COVID, this sort of activity we want to see become, you know, the new normality. So let's not dispense with all the good stuff that we did previous to the COVID emerging. Let's now have a blend going forward and start to develop some of these ideas further, as you know. So Tom talked about the learning, taking learning from this, and these are certainly aspects that we want to take forward and improve the service that we deliver.
Thanks. So I'm just going to, I suppose I will just push at that a little bit more, because I know that's your aspiration, but the question is what plans do you have to do that? And I'll bring Andrew in.
Well, thank you, Commissioner. And actually, where you brought me in is pretty much covering what I was going to say anyway. I'm sure Phil would have said it himself. So what COVID's done is it's turbo boosted the direction that the service was heading in anyway. So plans wise, we have got a new set of principles that have been introduced through Ambition 2025, which is our direction of travel over the next 5 years. And that's about the empowerment of colleagues across the service to take accountability and responsibility for their area, their geographical area in the case of fire stations, but then give them freedom and flexibility to get on and do what they need to do to keep their local community safe, rather than having a blanket approach across the whole of York and North Yorkshire, because the types of hazards and types of people are not the same everywhere. So what the long-term plan was to move in that direction. What COVID has provided the opportunity to do is to get that operating much more quickly, and what the examples that you've heard today show is that there's a willingness and an ability amongst firefighters and other service delivery staff to take responsibility and accountability, and to use that freedom and flexibility to come up with new ways to do things. So this is no longer top-down directives from the senior managers of the organisation. This is a strategic direction being set about maintaining the safety of our communities, and then allowing people at local level, affording them the opportunity to get on and do what needs to be done, and to be creative in the way that they do that. So this has demonstrated, not only in the next phases of COVID will there be an ability to be creative and to find new ways to deliver, more efficient and effective ways to deliver, but also in the much longer term, it demonstrates an ability within our workforce to do that, and that should give them real confidence that they'll be trusted to go on and and try new things, that they'll be acknowledged when those things work well, and if they don't work as well as was hoped, that there'll be no blame or finger pointing, but there'll be learning that will be taken from it, that we can further adapt the work that we do, and it will make us much less of a stilted top-down organisation and much more of an agile, creative, service delivery oriented organisation.
Thanks, Andrew. And I entirely agree with the philosophy behind that. And I'm all for devolution and responsibility, which is what you said there. But sometimes you do need a consistent approach. And obviously, there are standards by which the fire rescue service operates. But I suppose when you've got local innovations like this that are really good, you know, if you've got this sort of devolved approach, how then do you encourage people to take up some of the ideas across different areas so you can have a bigger impact?
That's a really good question. So of course there is a need for consistency, and we have a guidance and policy and procedure for those areas of work which are statutory duties and which require high levels of risk management, so particularly in the response field. So there is consistency in that approach. Everybody across York and North Yorkshire can expect the same level, quality and consistency of response when they dial 999 and request a fire and rescue service. In terms of our prevention, protection and resilience work, we will tailor that to local need. And your question is, how will we know what's working and share what's working so that other places can learn from it? So I mentioned earlier on a couple of phrases: accountability and responsibility, and freedom and flexibility. And they are two of the three principles which I'm introducing to change the mindset and the way that we work as a service. The third principle is about measuring and monitoring. And we're putting in place a mechanism now to enable those service delivery staff to record the work that they've done, but most importantly, to record the impact of that work, the success of it. So the impact on changing the way that the public perform, changing the levels of knowledge, awareness and behaviour of the public to reduce the demand that they place upon us as a fire and rescue service. Now, once we are able to demonstrate the causal effect, the impact that those activities have, we can then identify the ones that have the best impact on the public, share that knowledge across the service so other people can adopt it, and we can make sure that the resources that we've got, the people and the funding and the equipment, is used to where we know that it has the greatest effect on the public's performance, on their ability to keep themselves safe. So that'll do a couple of things. It will recognise and acknowledge the success of those people who have introduced new ways of doing things. And it will also enable them to really successfully share what they've done across the organisation so that other stations and other workplaces can learn from that experience. And what we'll really encourage is that, as well as sharing successes, that people share the things that haven't worked as well as they'd hoped, so that everybody can learn from that as well. The technology that Phil talked about earlier on, in terms of the video conferencing facilities, what I'm keen to exploit more and more is that stations will speak to each other, that work teams will speak to each other and say, we tried this, it didn't quite work, or we tried this and it worked brilliantly. And well, just a touch of frivolity, but with a serious aspect, is the BBC's motto is nation shall speak peace unto nation. And I have the notion that in North Yorkshire, station shall speak ideas unto station. And I think that providing that kind of technology affords the opportunity to do that. So firefighters in Scarborough can talk to their colleagues in Harrogate without having to be in the same place, without having to travel tens of hundreds of miles. And similarly, our on-call staff, Robin Hood's Bay and the far east of the county, can talk to Bentham and the far west of the county and share their ideas and their experiences. So there's lots of things being put in place to really enable us to introduce this new approach to delivering services.
Thank you.
Can I ask a bit of just a quick so Andrew, maybe a question for Dave really. I know a lot of work has been going on to create that kind of central repository within the internal system around prevention activities, so that there can be more consistency across the piece, and you can pick from, you know, a predetermined selection of activities that already exist and we know work well. So in terms of the booklet we've just seen, you know, schools education clearly is going to be an important one across the whole area. If it, just as a simple example, would we be able to go into that central repository and find that booklet, so that, say, in the way in Northallerton, in Scarborough, in Harrogate, in Skipton, and so on, that booklet could be distributed by local stations now to their local schools, so that actually this good practice, which has clearly benefited local schools, could actually be replicated and rolled out. Just as a really simple example, I think that's the point we're trying to get to here, is where are we seeing this in practice, and how are we getting that consistency across that piece, learning from what has gone well in the first phase, please?
I think you're right. I think either Dave or Phil will be best placed to answer that question, as it's their area of work directly.
Yeah, what I'd like to highlight here, I suppose it's often not a one-size-fits-all, but there is certainly benefits to achieving that consistency. And as a service, we've recently been developing our strategies for the 3 different directorates. So John Foster, as deputy, has developed the service delivery strategy about, you know, obviously focusing our services to the vulnerable and so on and so forth. In terms of my directorate, the capabilities, the strategy really revolves around providing the guidance, or receiving the guidance and then providing it out in the format that's easy for people to follow, providing the expertise to assist service delivery to either deliver the capabilities themselves, to will deliver themselves, and then really providing the resource, whether that's systems, you know, data systems, or what have you. It could be the fire engines themselves, but certainly with prevention and protection sitting within the capabilities, my directorate as such, that those sort of like elements would provide service delivery with what they need. So I think, in sort of answer to your question there, Tom, that's the bit that sort of like joins it together really, and that's where we'll achieve some consistency, if that's the right way to go. And then the final directorate, last but not least, is Jonathan's as the other area manager in terms of the assurance piece, which is what Andrew's touched on, in terms of being able to evaluate our activity in much more depth and accuracy, to actually decide for, you know, what is valuable, what is having an effect, you know, that causal effect on the community. And if it's not working, then, you know, we won't do that anymore. But arguably, if it is working, then that's something that we can identify and then share across the service in a more effective way than we maybe currently are.
Fantastic, thanks. I think Steve's got a question now as well.
Yeah, mine was just more of a point on in terms of the uniformity across the service. One thing that's fundamental to being able to deliver that is the IT network and the support and the reliance on IT. And we do still see right across the service, and it's a massive frustration with staff on stations, is the inadequacy of some of the IT. And whilst we've invested in the ability to provide Teams meetings on stations, in terms of the IT network, there are still deficiencies within that. So therefore, there are frustrations in being able to do that and deliver that work. And then there's also the issue around the additional stress that some staff feel because they've not formally had any IT training or input, so people are doing it on a ad hoc basis, worked out through you know, have a go skills. So I think fundamentally to some of this being uniformly delivered is that there does need to be significant investment and look at in the IT systems, the training and the support that's available to staff in able to get some of this working. So yeah, I understand, you know, some of the frustration, but these aren't just new frustrations. They've been there for some time, and it does need. It is a key area going forward when we're working more remotely to ensure that those systems are up to speed.
Thanks, Steve. So I'd imagine that this sort of new ways of working has sort of highlighted some of those issues even further. So Andrew, do you want to come in?
Yeah, just briefly, Commissioner. Steve raises some valid points. The network and the provision of Microsoft Teams prior to COVID really helped us to be able to deal with the crisis, and that's testament to the ICT team. But we do recognise the need for investment, and that's why one of the 3 key opportunities I've identified for us as a service over the next 5 years is saving enough money to invest, to modernise, and one of the categories for investment is in ICT and technology, because at the moment we are stifled to a certain extent by the lack of investment that's gone previously as a result of financial reductions to the overall budget, but we do recognise the need for further investment in IT and technology so that it further enables us to do more of this work. I acknowledge absolutely what Steve is saying. I think we've come a long way, but I think there's still a long way to go.
Thanks. So can I just is it Phil? Are you taking over the reins again?
Yeah, I will do, Commissioner.
All right, we've just got, just so you know, that we're due to finish at 14:40 on this agenda item, so you've got 8 minutes.
Okie doke.
Okay.
Next slide, please, Dave. I'll try my hardest. So the next slide really is about the learning and really what we've done to try and sort of like achieve the learning and be able to share it and act upon it. So at the very outset, actually, we ran a business continuity exercise to sort of like run through some scenarios before we really got into the depth of the COVID phase as such. And we took some learning from that and applied it throughout the period that we've been talking about. And then once we were really in the midst of the COVID phase, the first phase there, we ran an exercise called Exercise Bianco, which is a real-time no-notice exercise, which was really interesting actually, because it certainly put people on the spot as to, you know, what we would do in reaction to certain scenarios. And this scenario actually developed all the way through to an unfortunate fatality linked to COVID, so a member of staff fatality.
Can we just make sure that just people are aware that that wasn't a real fatality linked to COVID?
No, all exercise play,
Yeah,
but felt real at the time.
Yeah.
So yeah, it was a really useful exercise, and we wanted to do it as real as we possibly could. So when we talked about a member of staff having symptoms and it was affecting the station itself, we didn't just do it in theory. We actually debunked the station from Scarborough, and we went to a temporary site that we'd already identified to work through the arrangements as to how that would work. And from that, we actually got some really good learning about the logistics and some of the bits that we thought we'd covered, but evidently we hadn't once we put it into practice. So it was really useful. And in fact, this went all the way up to the national arena. So Andrew made a call to the NFCC chair to inform him of the exercise and what the scenario was. And I think that then tapped through to the Home Office as well. And as a result of that, there's been learning on all sorts of levels, you know, from a national perspective, the guidance relating to firefighter fatalities, for instance, has been altered as a result. And then equally within our organisation, there's been some real key significant learning coming out of it. So we have recognised that we do need to tighten up in terms of our, some of our business continuity arrangements. So as a result of that, now we're doing a full review of the business continuity processes, and that's been run by the Assurance Directorate with a completion date for the end of the year. And what we hope to be able to achieve there is for every section head as such to be responsible for their own business continuity arrangements rather than have it as a centralised function. Yes, it will be overseen centrally, but each section head, for instance, will have the responsibility to ensure that they put in business continuity processes which will enable our organisation to continue ticking like it does currently. So yeah, new structures to be embedded. We learned quite a bit around the comms side of things as well, and I think the Office of the PFCC had a part to play in the comms as well, where we had a local media outlet actually contacting you for a piece around what was actually occurring. So, and again, this was across all organisations. So PFCC, Fire, Enable, we've certainly identified, as is usually the case actually with this sort of thing, that comms, there are some weaknesses to the way that we operate, and we will improve upon going forward. So yeah, it was a really interesting exercise that we ran. I suppose augmenting and supplementing that, we've done a staff survey because, again, picking up on some of the points that have already been mentioned here. So IT, you know, the provision of the technology, how do people feel about that? Are they finding it okay? How is people's welfare, more importantly, I think was a very key aspect of the survey. So important for us to do that and then take the findings and then act upon the findings. So we are finding that for different people, it feels different. As you know, certainly the remote working, there is for some people a feeling of isolation because they don't have that social contact. So again, it's learning that we need to take and act upon and put in systems to ensure that our staff are adequately provided for in terms of welfare and so on and so forth. There is currently the HMI are running their COVID-related inspections, which is happening in every fire service within the country. So we've had the first data request come through, which we've now committed to and delivered, and we will be getting interviewed in November, I think it is, so that the HMI can judge us on how we've actually performed in terms of COVID, specifically COVID-related activity. And again, we will welcome the findings from that so that we can build that into, again, our overall learning process and make sure that we act upon it in the right way. So all of the learning that we're achieving here is captured, and it's captured by that assurance directorate to then feed back into the organisation in terms of action plans, you know, actions to be undertaken to make sure that we actually do react in the right ways to the learning and make our effectiveness and efficiency and how we treat our people as well better going forward.
Phil, I really do need to move you on. I'm really sorry. There's 2 more slides, and you're going to eat into your own performance time because I'm not cutting. So please just crack on.
Yeah, the next slide really very quickly. Perhaps this is well, I would hope this is more about good management rather than good luck. But that's a graph really that shows our absence figures throughout the COVID phase to pretty much current date. So from end of March up until current. The blue line represents what we had normally in terms of sickness absence. That's what we normally would expect to see. The orange line is COVID-related absences. So it does actually say self-isolation on there. It was a mixture of COVID absences. So I think really what the graph shows is that it is in manageable terms is our COVID-related absence, which, like I say, I hope is down to good management in terms of the control measures that we've applied, keeping our staff safe and preventing that infection potentially from spreading across the organisation. Which moves me quickly onto the next slide, the final slide, in terms of where we're going now into the future. And I think really, in summary, it's sort of like a collection of what we've already discussed really. So there's a massive amount of learning going on. Certainly the new way of working, we won't dispense, like I said before, with everything that we've been doing before because we do some really good stuff. But what we will do, we will take the learning, we will take the different ways of working that we've experienced through the COVID phase, and we'll continue to apply them going forward. So certainly the use of the technology has served as well, and it's something that we will continue to progress. There's all sorts of different elements that we will look to do differently as we go forward. But again, we don't stand still. It is a continual process of learning. So unfortunately, it looks as though that second phase is very heavily upon us. There will be more learning that we can achieve and then apply as we go forward. But yeah, just very conscious that that is now on the mark in terms of time. So
well, unfortunately, it isn't actually. You've got 5 minutes for your performance update. So.
Okay.
So let me just check the agenda again. But if Jonathan, if you want to load up and get the next element of your presentation, that'd be fantastic. And can I just take, whilst Jonathan's doing that, take time to thank Phil, you and your team and firefighters on station for your contributions to this. It was great to see them beaming in. So fantastic, and thank you very much.
You're more than welcome. It's been a pleasure. And Commissioner, I forgot to say at the beginning, I need to leave to attend another meeting at 3 o'clock, if that's all right. So
yeah,
I'll hand over to my colleague Jonathan to run through the performance pack.
Okay, so this agenda item is supposed to run until 14:45.
There we are. Oh.
Jenny, do you just want to take us through?
Julie, I'll just give you a précis without putting the slides up because it's going on there. The important part of our performance, I'll hand over to Mindy and Emily Mayer about the EDI work we're doing. As a précis for the performance that we've been doing, we've seen a small increase in August just on AFAs. However, this is only within about 10 to 15 in actual number, and this is still significantly lower whilst we consider that the national average is climbing year on year around 231,000. So our reports are still very low within there. We've seen an increase on persons trapped in vehicles, but this was predominantly in August, and again because people are returning to the roads, summer holiday periods, so we have seen that slight increase. Again, this has still been worked with through the prevention and protection departments in there. Fatalities. Now we have 3 recorded fatalities in August. 2 of these are actually over the border incidents where our crews attended to support, and 1 within county, which was a co-responder with a cardiac arrest. We have had no reported road traffic collision or fire fatalities within that period. Slide 5, which is in the pack, is about our critical aspects of business service, and this, because I can't see it on the screen, we reported over the quarter, or in August, a 0.9% where we were actually at critical. This, of course, was dealt with by moving people around the districts and making sure we got geographical cover. And that was down to literally the last 10 days of August, where we were working with an increased number of sickness due to COVID and also annual leave within that period. Slide 6 is our on-call availability. We're still reporting and seeing 6% higher availability than last year, and again district managers are working with our on-call staff to try and maximise and maintain that availability wherever possible. Again, this is feeding into John's on-call review, and the learning that is coming from there we are actively pursuing to make sure that we can maintain that wherever possible. Slide 7 is onto sickness statistics reporting, which for us is great. On to the top left of that screen there, the whole time reporting. You can see we've had a reduction there across the quarter, and as a binary comparison to last year for whole time, short-term and long-term sickness. Onto the right-hand side for on-call. Now, we had a slight increase in the long-term sickness, but nationally, the fire service has seen significant increases in musculoskeletal injuries and also mental health support that is being sought. So this is something that the services and regionally and nationally, we are looking to obviously provide that support through occupational health and again regionally wherever possible. Enable have seen a decrease across their board.
We're going to have to move this on. Can you just go through exceptions, if that's all right? Anything that you're sort of worried about, as opposed to slide by slide, because we are going to run out of time otherwise. And I want to give Mindy some time as well.
Yes. The only thing, there are nothing to worry about as a positive. On our national reporting, we have the lowest firefighter whole time sickness, only 1.62 days, and that's something for us to celebrate and testament to the work that we're doing to maintain that. I'll hand you over now to Emily May Williams and Mindy when they will go on to the last slide, which is reporting on the EDI framework work and this survey for the HMI.
Thanks. I'm sorry to that was a bionic speed.
Mindy, do you want to take the first facilities review?
Yep. Hiya. Hello, everybody. So as an outcome of the HMI inspection that we had carried out, there were issues regarding the facilities review and facilities we have on station. Now, myself and Michael Davies, the estates manager, have visited all the whole time stations, and we do have facilities in place for all our staff. However, due to the ageing estate, they are adequate, to say the least. So we have looked at proposals to bring those up to standard. However, we do need a lot of investment in stations to do that. In looking at those stations, we have kind of seen that there would be a knock-on in terms of increasing our diversity on some stations as well, due to the fact we can only offer limited facilities at certain locations.
So which are the locations that really need the investment?
One of them in particular is Scarborough Station, and it's due to the age of the building. Whitby Station is another that is, we've kind of outgrown the buildings. They were fine when they were built. However, we've changed a lot from when they have been put up, and they're just not fit for purpose at the moment. So we do need a lot of investment in those. Michael Davies and myself have put some proposals together to try and sort out some of the immediate issues in terms of privacy and dignity, and that paper has now gone to SLT at the minute. We still need to visit some of the on-call stations, so we will have visited every single station by the end of November.
Fantastic, thank you.
Okay. The next bit we've got on there is local positive action, but I think you've already actually covered that from Northallerton Station as well. It was just to say that all of our whole-time stations have taken on board the technology and have actually been trying to run positive action events and keeping in touch with their local communities. So one example is Scarborough Station, who've re-established contacts with their local communities, in particular the minority groups, to make sure we are getting in touch with those groups in terms of fire safety prevention work, but also raising the awareness of what we actually do. And from what's been said previously, that is carrying on across the board for everybody. So that is some really good work that's happening. Sorry, I'm rushing it because I know you said. Emily, do you want to go on to the National Women's Forum?
Yeah, so
Thanks,
throughout COVID, we wanted to achieve something because we couldn't do anything face-to-face really in terms of meeting up with any other groups. So we hosted the first National Women's Forum, which we pushed in through NFCC, and we were the first service to manage to get 34 fire and rescue services in a Microsoft Teams meeting, and had a specific agenda where we spoke about positive action, sharing practice and success stories, reducing barriers, staff networks, mentoring women and other minority groups in the fire and rescue service, and reverse mentoring. And we've got some minutes and documented on that and how much of a success it was. And that was collaborating with Chief Fire Officer Alex Johnson, who have now taken the lead, and we're going to rotate around all 34 fire and rescue services to kind of keep sharing best practice. The other thing that we did throughout COVID was we did a survey at the start of 2020, which identified some areas that we needed to look at as a network. From that, we've developed, and we're now issuing welfare packs to all our female operational staff that can be mobile with them, so they can carry them on the carry bag that they take on the pump, or they can keep them on station personal issue. Addition to that, we're also going to issue them to our flexi officers, so our station managers and our group managers, so that they also have them for any cross-border incidents, or if it's a protracted incident and they've used the bag, they can then contact the station manager or group manager there for a resupply. From the survey, we also found that the facilities identified as more priority areas of the facilities that needed updating, and it was a really good key into what people wanted, what they thought they were lacking in, and where Mindy could go look at first and prioritise them areas. The positive action through COVID, we were quite lucky that we managed to get a lot in before we got official lockdown in March, and managed to do some Keeping in Touch Day and celebrated International Women's Day for positive action. And we've also been doing virtual sessions online, fully hosting an awareness session for people, and we've had over 1,000 views on YouTube for people that applied for this upcoming recruitment drive, and they've been quite successful. We're actually tracking and tracing them through the recruitment process to see the improvement from the 2019 application to the 2020 application. And in a fast bubble, I think that's about it from
all right. That's fantastic. Thank you so much. And I apologise we've had to rush so much at the end there. There's a lot to get through. Everybody's been very busy during COVID, and it's good to see some really tangible stuff going on around the equality, diversity, inclusion. So thank you very much. Steve, I know you've got your hand up. I really do need to move this meeting on now. Can you be super brief?
Yeah, very brief. It's just listening to the EDI report there. It's quite heartening to realise after 10 years of hammering at a fire authority's door with issues on facilities on stations for female members of staff, and also facilities incidents, that we are now starting to move forward in a more progressive and responsive manner on that. And I just like to say that, yeah, I just wanted to comment on that, because I've been raising this for the last 10 years and got nowhere, so now it's starting to move in the right direction. That's appreciated. That's
great to hear. That's really great to hear. So just to say thank you to everybody for your contributions today. I do apologise for rushing people, but we have got a full agenda. So if that's everything, I'd like to now move on to North Yorkshire Police's contributions to this meeting. So thank you, fire service colleagues. It is much appreciated, your time and all your work. So Lisa, I'm not sure who's going to. Is it Mike? Are you going to start?
I am. I'm just trying to share. I'm just trying to share my screen. Just 1 second. Technical difficulties already.
Mike, I can share mine.
Oh, well, it's only me. It's only me doing it. So you can pair up with me, Tom, and help me out. So that's excellent. Thank you very much for that. Okay, so while we move on to the first slide, I'll start with the strengths in terms of the North Yorkshire Police response. I've been the Gold Commander, the Gold Police Commander throughout at the time that the pandemic's running, and still maintain as we go back into a full response phase in terms of the second wave. As still the Gold Commander for the police, but also the chair of the SCG. But what we'll cover here is the learning so far, not get necessarily into what's happening now in the present, but again, we'll start with the strength side of things of what we found over the last few months. Being prepared, definitely being prepared right at the start has certainly helped us as an organisation. So December, January time, we were just coming through the planning for Brexit and for flooding. And we were aware of the COVID pandemic, but at that stage it was not affecting the UK shores at that time. However, we initially started to do some planning assumptions in terms of a reduction in the number of staff within North Yorkshire Police. That started very early. That picked up pace through January and February, leading us to having a COVID Operation Teller, which is the national operation name for the police in response to COVID-19. And basically we had a single point of contact and set up a command hub running, which was just in time for lockdown. Now this essentially meant that we had a command structure at gold, silver and bronze, and a communication plan in place covering both our own response to the crisis, but really importantly our partnership responsibilities for the crisis within the LRF. So due to this, we were able to maintain an effective service throughout the initial lockdown and provide additional resources needed for the enforcement activity in the early stages. Now, early implementation of a communication strategy was vitally important. It's fair to say that certainly between North Yorkshire Police and the PFCC's office, there's been an incredible amount of communication, basically explaining the police response to this, because there was obviously a lot of emphasis on how the police would be involved, but also trying to assist partners in educating the public around what the powers were and what people were and were not allowed to do. And we all stepped up to that and were able to have that good communication strategy. Now, the internal communication strategy, importantly though, allowed for a single source for the staff to access an important information on frequently asked questions. We had a learning zone set up. We had coronavirus daily bulletins for all the staff. And we had an Optala subsite. The flow of information from the National Police Chiefs Council, the flow of information from government, the changes in the Health Protection Regulations 2020 came thick and fast, and on a daily basis. It wasn't enough to just look at it every 24 hours. They were continually monitored, continually reviewed, and importantly, we sent that communication out to our frontline staff, so they really knew what was going on in terms of how we expected them to police the communities. In terms of the force control room, there was early implementation using the Harrogate police station as a force control room fallback. That having two sites allowed us to increase social distancing, reducing the risk around virus transmission and the track and trace, and also maintain effective service delivery to the public across all our platforms, 999 and 101. In terms of logistics, this was a really key part as well. So having that COVID command established early gave us the opportunity to wrap the logistics around the changing needs of the organisation as we moved into lockdown. So, for example, being able to issue equipment to home workers and repurpose some parts of the business to undertake additional tasks to keep the force working. In terms of the partnership working, very early on, the first meeting that I chaired as SCG chair was on the 6th of March, which is the same day that Fire initiated their work as well. Some really experienced personnel around the table within the LRF. So there was an early formation of the multi-agency coordination centre function with a direct link into our own Operation Tallow Hub within North Yorkshire Police. Again, just around the smooth flow of information and decisions feeding into the 4 strategic and tactical meetings. It really was very much a joint approach in terms of that. Just talking about management of mortality just for a couple of seconds. So North Yorkshire Police is the regional lead for something called Operation Power, which is a national operation in relation to disaster victim identification. Because we have experienced staff within North Yorkshire Police, we were able to quickly establish a management of mortality function working with local resilience forum partners, which was a mortality function with a care centre, working closely with the Nightingale process, which Fire did an absolutely tremendous job on. And we were able to set that up very, very quickly, but also importantly around the testing, which is still vitally important as we speak now. North Yorkshire Police were able to establish, working with partners, a mobile test unit, and an example of where that was set up was at Drax Power Station, which was seen by national partners as a gold standard of how to go into a particular organisation and get them mass tested to get the results really quickly to keep national infrastructure running. The police, the fire, and all partners were involved in that. In terms of valuing our workforce, I link back to the communications that I've talked about there. By sending real timely communications and having a Tallow Hub that worked literally 24/7 meant that we did value our workforce in terms of them being anxious, not knowing what information was correct. They could go to that one point of contact. And certainly our workforce have adapted and demonstrated a high level of commitment throughout the first lockdown. Very highly motivated team that I'm personally proud of. I know the Chief Officer team are personally proud of, and yourself, Commissioner, as well. So, and we've told them that on lots of occasions as well, obviously. And in terms of adaptability, visibility and engagement, obviously we talk about the 4 E's, which has been prevalent since March. But in terms of adaptability, most departments have found themselves having to deliver a service in a completely different way. So, for example, we made a very quick change in the recruitment and training methodology, which allowed us to recruit and train both police officers and PCSOs in a completely different way throughout the pandemic. And what I believe to be a risk at the start that we would suffer in terms of bringing in the relevant numbers of police officers and PCSOs due to not being able to safely train them, that hasn't been the case, and we've maintained our numbers. In terms of public confidence, so by maintaining local policing functions, it's allowed us to enforce lockdown with the consent and support of our communities in a very unfamiliar and uncertain operational environment, I would say. There's been some negative media nationally, but certainly through a sound comms strategy, it's kept the public very much updated on policing plans for all of our communities across North Yorkshire and the City of York, which I believe was supported by the North Yorkshire public and business communities. And we certainly did a lot of engagement with the public and business communities, and we did get their support. Certainly the understanding of the powers in relation to the 4E strategy was very, very important, and we did see a real big increase in visibility across the county and engagement, which we needed because we saw vast numbers of people travelling into North Yorkshire, it being a tourist hotspot, people with second homes here, the stunning scenery, what we have to offer in North Yorkshire meant that people came here, and we had a very big job to do around the 4Es. And yes, unfortunately, we did have to enforce over 1,000 fixed penalty notices largely for non-essential travel, but it was the right thing to do in those circumstances. An example as well of looking at public confidence was the issues we had at Richmond Falls. This was a particular issue, especially when the weather got nice during lockdown. There was a task and finish group set up by Helen Grant, who's the councillor and as community safety lead, a lot of public consultation, and eventually a public spaces protection order was applied for. But whilst we were waiting for that, there was a lot of joint working, deployed a multi-agency response team which had council duty officers, private security, street scene officers, so parking enforcement, to be able to show the public, because it was hitting regional and national news, that we were actually doing something about it in such a small location. But because of North Yorkshire being as it is, people were flocking there. So just moving on to the next slide, please, in terms of challenges. So very much policing the unknown is what we were dealing with initially. And it was a daily changing environment, and it meant that we were responding with little or no notice to national and local directives. So this was felt in all areas of the force, from the legislation being applied through to enforcement, due to the technology and the equipment being used, especially around the PPE, which was very important. Again, moving back to valuing your workforce, it was a risk initially that we might not have enough PPE. We certainly worked really closely with fire colleagues. We had PPE spots to be able to make sure our colleagues had the right new equipment that they weren't used to wearing, weren't used to using, available when they needed it. We also had operational challenges as well during that point, in terms of quite a number of Black Lives Matter protests, which fell outside of the legislation back then, so they were allowed to go ahead. But this had to be balanced, against the human rights legislation, but certainly had an impact on resourcing at the same time as us trying to put as many resources out into the public of North Yorkshire to try and use the 4 E's. So in terms of challenges, there was demand in the FCR in relation to the increased reporting of breaches of COVID legislation. Now, realistically, we couldn't respond or physically attend all reports of people reporting minor breaches, particularly in relation to private dwellings, or people taking more than one type of exercise. But what we were able to do was set up an online reporting tool specifically for COVID breaches to help manage this demand. That reporting tool is still there. It's used on a daily basis by the public, and then we review what's on there and we deploy our resources appropriately to more of the higher risk reports that come in. In terms of criminal justice, we could go into an awful lot of detail around criminal justice, but clearly this is a key part of the policing process. But from grinding to a complete halt, which it did initially in lockdown, the challenge of restarting elements of the criminal justice process in a safe and legally compliant way have been huge for all partners involved, including the police. Again, this was a national problem, but certainly felt on a very local level as criminal justice impacts on all parts of the chain. And we've certainly relied on yourself, Commissioner, to try and challenge back nationally in terms of the impacts on North Yorkshire to ensure that we did get the courts back up and running, which we have done, and criminal justice partners obviously have done. In terms of local and national data return, that was definitely a challenge, because it was an ever-evolving demand for data returns to be sent in, putting pressure to meet those requests and timescales. So what we were able to do is use the business insight team to streamline and provide an effective solution for the external requests in turn, and also providing the organisation with a new readily available live snapshot of staffing picture at any one time, which was really crucial in the first early days, early weeks of the lockdown, to make sure we had sufficient resources on duty. Tourism and exercise hotspot, I've already mentioned. We had lots of people coming in for tourism reasons, just for a drive out to come and exercise. Certainly managing expectations from the organisation and communities around beauty hotspots and exercise opportunities presented challenges. We had a large influx of people coming in. Weather played a key part in that, but then we had challenges on the roads in terms of speeding. We had challenges in water, challenges with river safety, and the demand on other emergency services such as mountain and cave rescue, including at least on one occasion the mobilisation of specialist support such as heart teams and specialist search and rescue. And another challenge on this slide, the estates and the fleet. One thing that wasn't apparent initially but soon became a problem was the shrinking supply of spare parts worldwide. It put extra pressure on the fleet to manage the maintenance of the Forces Fleet Service, and they did an absolutely tremendous job to do that. But also in terms of the estate. In the early stages of lockdown, a lot of work was needed, especially in police custody areas, to protect our staff, detainees, legal representatives, nurses, and everybody else who came into a custody suite. So obviously screens were put up, and we used technology to conduct virtual legal consultations where appropriate. And there were certainly screens put up in our front counters because we didn't want to close our front counters for the public coming in. And there was a programme of enhanced cleaning in certain areas, both proactive and reactive, and obviously to get the estate fit for people to return to work if we needed them to return to work. So just moving on to opportunities. Technology and agile working. So in terms of technology,
Tom, sorry, Tom, did you want to come in?
Yeah, I just wanted, sorry, just before we move on slightly there, because I can't, sorry, I realised I was flicking through the slides that were presented there slightly. I couldn't see it coming up later. I just wanted to touch on the criminal justice bit because I know we could go on there, but just to get some assurance for the public on that point around the measures that North Yorkshire Police are putting in place in terms of victim and witness care in particular, to make sure that justice can continue, because obviously the majority of cases that fail because of a victim or witness dropping out. So would it be possible just to quickly provide some assurance around what you've learned in terms of the criminal justice side of things, and provide some assurance that you are putting measures in place to make sure that justice can continue to be delivered?
Yeah, absolutely, Tom, and it is a vitally important point. Those victims, those witnesses who've been waiting for court dates, absolutely the pressure felt from their side of things has to be at the forefront, and has been at the forefront, not just of the police's response to getting the courts back up and running, but obviously the courts themselves, our criminal justice partners, have done a tremendous job to get the courts back up and running, but within a safe environment. So those people who are attending court now, I've certainly been to court once and going again next Friday. In terms of ongoing cases, they have a safer environment for people to go into. But the key thing is that from a victim witnesses point of view, the victim care teams should be in contact with the victims that are currently waiting for cases. The communication to those individuals should have been conducted so that the expectations are set. Many cases have been put back, absolutely, but there's clearly a risk assessment that has been conducted to get those cases with the higher risk element to them in terms of the level of harm to that victim into those courts as quickly as possible, but in a way that all the evidence can be sufficiently presented so that a fair trial can be conducted, because obviously those fair trials need to continue, but in a safe environment. So a lot of work has been done with criminal justice partners to ensure that communication with those victims and witnesses has continued. Certainly our prosecution team at York have been heavily involved in working with those partners. I have a gold meeting every 2 weeks now, but was every week. Criminal justice formed a big part of that gold meeting for me to understand those strategic risks and issues, and if I needed to involve other partners such as the Police and Crime Commissioner to write to national bodies to try and explain some of the concerns and issues that, yes, we were feeling locally and regionally, but to make sure those cases within North Yorkshire and the City of York went ahead safely, and those victims and witnesses did not feel any additional anxiety on top of what they were already experiencing through waiting to go to a court procedure.
So I just suppose the other thing to mention is that I chair the local criminal justice partnership, and we had emergency meetings on a very regular basis throughout the pandemic, looking at how we could put that support in place, particularly for victims and witnesses. But also we did a lot of lobbying at a national level to get additional funding for local services, and so we were awarded a significant amount of money to bolster our local services, particularly for victims of domestic and sexual abuse. So we've, that's been helpful, but there still remains quite a significant backlog in the courts, and we are going to have to continue, I think, to provide additional support to victims and witnesses for some time to come.
Agreed, and just in addition to that, if you're an OIC, an officer in the case, for anything that's waiting to go to trial, we should have regular contact with those victims, and victims especially, but also witnesses, to make sure that support continues. We rely also on victim and witness care services to do that. But as an OIC waiting for a court case, my expectation is that our officers are in contact with those individuals, because to make sure that their anxieties are minimised as much as humanly possible, and we give them as much information as possible. The last thing we want are victims of cases backing out simply because of delays or anything like that. So that's a significant risk that we need to manage from the police, working with criminal justice partners. Okay, great stuff. So just going back then, talking about opportunities. So technology, there's some brilliant stuff that's been conducted so far by our technology team downstairs, that weren't common use prior to COVID-19 and March this year. So Microsoft Teams, virtual interviews, being able to do remand hearings whilst in custody suites. Yes, that has been has meant that we've had to put more police resources into managing those. And some of those types, but using that technology is something that was probably unthinkable 12 months ago, and that we've embraced and brought in, and we're looking to maintain some of those changes into the future. So because they are effective, they are efficient ways of working. So technology, as with many organisations, not just the police, not just the fire, has really meant that we've got the most out of our workforce.
Sorry, do you have a figure on the cost of the additional resources we've had to put into custody for remand hearings?
I haven't got the overall figure at the moment, Commissioner, but it certainly it's been running now probably for almost 3 months, and there are police officers who need to do it due to the relevant powers. I can get that to you.
No, it's just I know that other forces are are really concerned about that, and the bill nationally is significant, and there's supposed to be some changes in the law that would assist us, but that seems to be slow in coming. So it'd be just interesting to know what that cost was.
Well, what I can say is it's been tracked probably to the penny, because we're aware that there is a potential that some of that cost would come back to police forces. What we want to be is ready to say, right, it's this much money. So we're keeping a real close eye on the numbers.
Okay.
Just in terms of logistics, so the pandemic has certainly increased the scope for joint working of North Yorkshire Fire Rescue and North Yorkshire Police through the enable function, and the work, as I've mentioned, around PPE. And just moving things around the county has been evidence that logistically we're working really, really well together. In terms of ways of working in the height of the lockdown, by necessity, we were dealing with a number of incidents by telephone, which proved to be a popular and efficient approach to certain types of report. So whilst we would always deploy resources to most incidents that require a physical presence, there are some opportunities to increase a range of incidents that can be resolved by the phone for the future. But interestingly to say there is, we've always resolved, certainly for the last 6 or so years, many incidents over the phone. But we have been able to increase that number because the public wanted that. They didn't necessarily want the physical presence of a police officer, and we've been able to risk assess that and make sure that the public get the service that they require, but we're also able to put our resources, certainly increase visibility whilst we were doing the 4E approach. And in terms of business as usual, moving people to work agile has provided additional and certainly support functions such as the FCR, which enabled the incident list to be reduced and increase the productivity around dealing with stuff over the phone. So what I mean there is, we were officers who, let's say, potentially were self-isolating or needed to work from home. They were still able to deal with incidents, still able to speak to the public from home and deal with incidents in a satisfactory manner as well, which was really, really good. And as briefly mentioned, the fire service mentioned doing some test and resilience exercises. We have had the opportunity to test every single department's business continuity plans on a mass basis. So this is something that we would have never been able to do on such a whole scale basis, but it's meant that we've been able to identify areas for improvement and put these in place, making us more prepared to completely alter the way we work, whilst at the same time continuing to provide a high level of service to our community. So a real lot of work done by the business continuity team around that. In terms of building stronger partnerships, we're fortunate in North Yorkshire that we already work closely with our partners across a wide range of emergencies and challenges. Recent experience from flooding to large-scale sporting events such as the UCIs or the Tour de Yorkshire, meant that at the start of the COVID response, we already had established working relationships across a real wide range of responding agencies. So we now have the opportunity, excuse me, to build on this even further, to ensure that this is not lost in terms of moving forward. And obviously now going into that second wave, those relationships are still there, which is I can tell you now as SCG chair is really helpful. It just means that you hit the ground running in terms of reacting again to the second wave of COVID. In terms of support and inclusion of the wider police family, some incredible support from the special constabulary and volunteers. We did not need at all to go and ask the question, can you help? We were inundated with their voluntary service in terms of helping to police the 4Es, helping to logistically move stuff around, helping to get the estate safe and secure for if and when people came back to work. So, that policing family have been, incredibly vitally important to us. In terms of managing demand, we are continually seeking new and improved ways to manage that demand placed on us, and COVID, as I've mentioned previously, has given us the opportunity to test some functionality, such as single online home, which I've mentioned is the COVID reporting, utilising different communication channels and greater use of telephone resolution. And just at the end there, safety camera vans, just in terms of that, although the roads were quieter during the initial response and lockdown phases, people were seen to be taking greater risks on our road, particularly on urban and rural road networks, creating increased demands for service. So the decision was made to continue with the visible deployments across the county on certainly our, routes where people are killed and seriously injured, and in those rural and urban locations. And that was something that came up very, very quickly, and a question asked to me, do we remove the vans from the roads? And the decision I made was no, we don't. And it was the right decision to make. And I stick by that decision to make sure that we tried our best to stop people speeding on the roads and taking the risks that we did see. And we definitely saw of those people who we did enforce again in the safety camera vans, certainly higher speeds by those people, which was evidence of why we needed to keep the vans out. And yes, I know some members of the public didn't support it, but I think the vast majority of the public did support it.
Mike, can I just ask, as we sort of face a second wave, what are you going to do differently this time around?
Differently, well, it's interesting. I mean, an incredible amount of hard work has been done to get all of our preparatory plans in place for managing the police and the police service, to maintaining the numbers that we have at work, in terms of policing the 4Es, in terms of whether it's down to road safety. We've already done a lot of work, which we believe, when we've looked back, has been the right thing to do, and has given us real good foundations for moving forward. So we will do a lot of things the same way in which we did before. The issue we've got now is that policing demand is back to pre-lockdown levels. So previously, and it's on another slide, there was a reduction in crime. And that allowed us to have much more visibility and focus on the 4Es. That isn't going to be the same now. So what we're doing is looking at our certainly from a frontline policing response, looking at how we're going to be able to manage the day-to-day demand of getting to those people who need us most, but also policing the COVID regulations. So what we've got is we're going to do much more joint working. So certainly last weekend and moving into the following weekends to look at licensed premises, to look at gatherings that we've seen in the press on Saturday in York. There's going to be a lot of joint working to make sure that we focus on those particular areas. If a national lockdown comes in again and we have non-essential travel, we know what we need to do for that. We'll review our plans. But what I don't want to be seen as, and yes, we have enforced more than any other force in the country, and we have significantly less police officers to be able to do that enforcement. What I don't want is to be seen as, right, we will get out there and we will do lots and lots of enforcement. It's important to remember that we will have and did encounter thousands and thousands of people, and it was only a small minority that did not, who weren't encouraged to return home in terms of the essential travel. So I'm really important. I want to get the messaging right for our police force to ensure that we aren't seen as a particularly enforcing force, but certainly that's not where we are currently. We need to adapt to an ever-changing environment, and the current powers that we're dealing with is the rule of 6. You know, we're dealing with face masks, we're dealing with people not self-isolating, we're dealing with gatherings. That is our main focus. So we're doing an exceptional amount of joint working with people and partners to look at events, for example, to look at those problem premises. So much more joint working is the long answer that we do differently. But Phil, I see you've got your hand up.
Yeah, thanks, Mike. Julia, what I would also say is Mike sort of alluded to the technology and the agile working from an internal perspective as a force, but actually given the rising in demand back to normal levels prior to the lockdown, and I wouldn't necessarily expect us to see that reduction as we did in the first phase of the lockdown from coronavirus. There's an opportunity there for us to look at how we can use some technology in reaching out to our communities as well. So again, technologies in terms of that contact, not just being by telephone, but also being by video links, such as the one that we've got today, running our meetings. These are some of the additional offers that in the longer term we can start to look to offer to our communities to provide that additional level of service. That means actually we can reduce the travel time required for officers to go and make contact. Again, if there's further lockdown restrictions, etc., it's more social distancing and safe to do so. So I think Annette Anderson, who's working on the recovery plan, will no doubt be taking into account some of these advances that we brought forward in terms of our use of technology. And actually, again, through the second phase on this, we could advance that even further in terms of not only internally using this technology, but externally using it as well.
Thanks. I think that would be welcome, and you have seen, I think, parish councils, for example, using these types of technologies to engage. And I think they've had much better attendance at them when people could do it from in front of their living room. So I think that'd be a really exciting piece of work to look at. I'm now going to be conscious of time with NYP as well. We've got 5 minutes for this element of the presentation, Mike.
Okay, we're into I think we've moved on to aims, and I can whiz through the rest. So I've mentioned already in terms of valuing our workforce and having a safe working environment. We have done that in terms of the communications and in terms of the right level and type of PPE that we have provided, but it needed to be a key aim, because having the right levels of PPE when it comes to track and trace and people using it correctly, make sure that we minimise the number of people that might be off with COVID and those who are self-isolating. Certainly the aim is to have the optimum service delivery across all areas of the police business, and as I've said, that advanced investment in technology has allowed us to be able to do that, and everybody working collectively together. In terms of forging and strengthening partnerships, I've already mentioned that in terms of how we're working as an LRF, and as we've stepped back up in terms of the TCG and SCG, so that's Tactical and Strategic Coordination Group, that's shown the strength in some of the partnerships that we've already forged. You know, in terms of the maintaining and promoting public confidence, you know, we need to maintain our resource capability through the remainder of this COVID phase, and you know, we're acutely aware that the virus is still present in our communities as we see now. So we're keeping a really close eye on, you know, the risks to our resources and our capability to deliver, a policing service. Obviously, our aim is to protect the NHS and support key workers, as it will be throughout. But the main aim of the police at the minute is helping the partners with their outbreak control plans as well. But also the aim is, as we've mentioned very briefly, is manage the financial impact, and we're keeping a very close eye on all the associated spend and then loss of income through COVID. So just moving on then to results. So with the measures and COVID mitigations put in place, as I've mentioned, NYP have successfully continued our recruitment process, and the investment in technology and training has allowed us to do an awful lot of remote learning. We've certainly maintained a fully effective police service throughout the pandemic with very limited loss of staff throughout. We've had some of the lowest absence numbers in the country. However, I think nationally the police are seeing an increase, only a small increase, in overall absence and self-isolation as the second wave hits us. We're able to absorb the additional enforcement needs easily whilst maintaining a strong visible presence. That's as I speak now, so we're able to do that, but we are putting extra resources out, extra patrols out to be able to do that. And we continue to monitor the post-lockdown environment from a resourcing perspective. We've certainly adapted a number of long-standing operational processes to ensure that we could continue to meet the needs of our public. So this was done in a structured and controlled way to ensure that the standard of service remained high when we were not physically attending an incident. So some of these changes may be suitable, as I've mentioned, to incorporate in a future operating model. So they're one of the things we'll do differently in the future. We've successfully moved a large number of departments into a working from home environment. Again, something that I'm sure that will continue long into the distance, and making sure they have the right equipment to be able to do that. And certainly all of our efforts over the last few months mean that we're now in a really strong position to respond to the second wave that we're in, or any other further lockdown. The processes and structures are now established, and the learning that we've captured will support us to continue to deliver an effective policing service. So what I'm saying is we are prepared. We've been prepared at the start, we're still prepared now, and we'll see what the future holds. And we just hope that all the measures put in place, whether it's nationally, locally, regionally, do what we want them to do, and reduce the spread of the virus. And that's my end of my presentation, really.
Thanks. So I suppose what I'd just like to do now is take the opportunity to say thank you to all of the frontline police officers and firefighters and staff and volunteers who have contributed to this extraordinary 6 months in our lives. I think they've done an amazing job in North Yorkshire, and are proud to have been part of it. So thank you to everybody out there. Really, really great job. Mike, I think we've now got Annette. Are you going to go through the performance update?
Yes, good afternoon. I'm just going to share my screen and the presentation with you, if you just bear with me.
Thank you.
Okay, I'm just checking. Are you able to see that now? Yeah.
Yep.
All right. Good afternoon. And right. So if we just take you through the mental health data from last month. Now, we did explain that there had been what is seen as a rise in incidents, and this is by the use of a auto tag. So it is a recording of incidents in terms of better recording. We did anticipate, as we said, the mental health potential and the impact with COVID. It is something that we're working closely with our partnerships with. We haven't at this stage seen anything of significance in relation to it. However, we are conscious that the impact because of COVID, in now the further restrictions, and working closely with them. In terms of 136, we haven't seen any of those being detained in police custody this year, this month, and that's only now 3 in the totality in almost a year now. So again, that's really promising in relation to that these individuals are being taken to an appropriate place of safety, which certainly isn't the police in police custody. Last month, we talked about what appeared to be a potential increase in the mode of transport, so police vehicles being used to convey people to to hospitals, and there was some concern. So we did some further work around that for the entire of 2020, but in particular, if there was anything that was COVID related, as we are all aware with all agencies, and particularly with the ambulance service, there has been increased demand. We were satisfied, having looked at all that data, that there isn't any significant concerns in relation to the ambulance service agreed level of service. So we have an agreement with them that they will attend within 30 minutes, obviously dependent on the geography, the large area of geography. And what we found that there was only 10% where there wasn't the availability. And the majority was suggesting that the appropriate risk assessments were being made by police and ambulance service. So again, that gave us the assurance that our partnership with the ambulance service and the impact of COVID hadn't really seen any emerging sort of concerns. We do with them because we do have now the winter months coming. The potential second wave, and also, you know, the impact, the normal impact on YAS. But again, we work closely with them. So again, we're really happy that there aren't any significant concerns with that.
That's good, because that is a transformation from a couple of years ago, isn't it? So that's really good news.
It is, and it really is sort of credit to our partnership team and the staff that work with YAS. That each of those instances anyway get looked at individually, monitored, just to make sure that absolutely the welfare of the individual is taken into account. So it's promising. Thank you. So in terms of incidents.
Just in terms of the outcomes that we're looking at on the mental health slide, obviously we discussed a couple of months back now the disparity there, and there was some work that was going to be undertaken, I think, engaged to try and understand why they weren't being taken into care. Has that been conducted yet?
It has, and it is ongoing in terms of our partnership arrangements, and that is largely because a real emphasis about care at home rather than in that, so within a secure environment. So again, we are happy that the initial 136 and the reasons that they're taken into detention. However, it is part of the health and the provision within the health setting that has, but it's something we constantly monitor in relation and work with our partners with that.
And we're not in a situation where we're seeing these people being released back into the community and then having to respond to them.
Yeah, not the case. I mean, you know, these are, you know, sort of some complex health issues, and there, of course, repeats. But I've been sort of very encouraged, impressed with the mental health work and the partnerships that on the Concordat that we had more recently, and it certainly is a sort of priority area for us.
I think the Concordat's got a lot better in recent months.
Yeah,
I think they've really done quite a good job with it in recent months.
Yeah, absolutely, and I feel that it's gone strength to strength, and again, really good that it's been chaired by our partners in the CCG as well. So it is you know, kind of moving in certainly the right direction. Okay, so in terms of incidents, Mike explained that we are returning to normal. We still have a slight decrease across the coast and the city areas. We are still probably about 10% reduction in incidents, but maintaining the same in county compared to last year. But in total, it's around about 6% decrease in incidents. We, from last month as well, we will get to the antisocial behaviour. We are still seeing the increase with antisocial behaviour incidents, but that is because mainly they are COVID related. Again, we're very alive to emerging themes, changes, the structures that we've got in place, our daily management of incidents and the understanding of those. Are well developed anyway, so again that enables to adapt, flex and respond to those incidents. So again, I'm satisfied that we have got a really good understanding of those changes. I think what again is encouraging with the work of Mike and the response phase of COVID is that we do try and predict, particularly now as we're coming into the winter months and changes and looking at how we best deploy our resources to these incidents. So again, this isn't about looking backwards about what happened last month. We're conscious about the planning for predicted and in sometimes unpredicted events as best as we can. In relation to crime, we still have seen a significant decrease across the board. So although we've gone back to some normality in relation to incidents, crimes has maintained on the whole to sort of decrease. We have had the slight increase, and we talked about again at the last previous months in drug offences, very small numbers. And that was mainly due to the increase in cannabis offences and also a slight increase. The numbers are low, around about 15 in possession of weapons. And again, there's nothing there that is emerging as a potential sort of theme, but something that we're monitoring in relation to that. But otherwise, there has been that significant decrease that has continued from COVID. But again, we expect that that may go back to normality as we go ahead. Schools have gone back, and it's something that again we'll just continue to respond to.
It's interesting that theft from a person has gone down so much. I wonder if people just not getting quite so close to others to steal from them. Anyway,
yeah, potentially the social distancing aspect. Yeah. So that may be a correlation, I'm sure. Okay.
Okay.
So overall, that just gives us a snapshot now in time, and just gives a summary of the overall decreases across the whole force area. In relation to domestic abuse, again, we have seen slight increases expected, but none, again, that is through better recording. We still have the really effective partnership arrangements that we started at the start of COVID to make sure that we have got all the support, the understanding, the awareness, what is, sort of very changing, along with potential hidden crime as well. So we've got very, very strong partnership arrangements in relation to domestic abuse. And I would say that is replicated as well across many areas of the vulnerability. So the arrangements and the partnerships that we've got in place with child protection, understanding around, sort of missing children, the impact of any increase in referrals of children going back to school and disclosing potential domestic abuse. We've got plans that are, again, well developed with our safeguarding partners, such as Children's Social Care, to understand if there has been, during lockdown, any further risks in relation to that, particularly as disclosures may be made within a school setting as children have gone back to school. So again, we have got those arrangements in place and plans to be able to respond effectively if that is the case, and we are seeing any increases across the safeguarding arena.
Can I just say it's been really good to see the focus on this through your ops board, and there's really clearly quite a lot of really good work happening in departments at the moment that's reflecting back through that, and it's just really nice to see that how much attention is being given to the detail around some of this to put those plans in place at the moment. So just wanted to say that.
Thanks, and it is a sort of a credit to all our staff that have been absolutely sort of working relentlessly and looking at how best we sort of support the public and provide a good service. And they're really I'm really proud of what they've done throughout this sort of the pandemic itself. So in relation to antisocial behaviour, as I mentioned previously a few moments ago, this is the way that we record it. So we have got a COVID-19 which is recorded as antisocial behaviour, but then we've got a further code that can actually break that down. So again, if we understand if it's youth related, I think we are seeing, even though it still seems huge numbers, some slight decreases, but again, sort of the percentages have to be taken into context with the volume of where we are now. But again, it's something that Mike mentioned earlier about it really is the response that we've got both on a daily, sort of weekly, and then pre-planned around managing that as best as possible.
So Annette, just on that, so the clear outlier in all of this is Craven, who have not only have seen pretty much double the increase as anywhere else, but also have an increase in public PSW incidents as well, whereas nowhere else has got an increase in PSW incidents.
Okay, I can look at the PSW a little bit further for next one. I think you're right, there has been an increase. In terms of the actual increase itself, we're pretty sure that again was down to the beauty spots at the beginning in particular, but I'll have a look and take the PSW to see if there's anything of significance there.
Yeah, it'd just be also really interesting to for example, I'm thinking about, if we're working with partners around these so-called marshals, this type of data might give us some information around where we store stuff earlier in the pandemic. And so if there was a big increase in, for example, in ASB in Skipton as opposed to Craven, then that would paint a slightly different picture. So I'm trying to sort of get behind the data a little bit to see how that might inform what we're doing.
I wonder if there's something there about if it is possible, as you say, to break out what is the COVID-19 stuff and what is actual antisocial behaviour, whether we could just get the antisocial behaviour stuff there and have the COVID-19 stuff separately, because obviously it does skew those figures quite considerably if they're mixed together. So that would be useful, please.
No, absolutely. So if I bring back next month, I'll just be able to bring a little bit further breakdown of the antisocial behaviour and the COVID-related, sort of incidents as well. So.
And can we just have a look at Craven as well, just to see what's going on there, because if you've got a 16.87% increase in PSW and such a big increase in ASB, it might suggest that it isn't all COVID related in Craven. So I would just like to understand that a little bit.
Okay, and I'll bring that back as a question. Okay, thank you. So again, in terms of this gives a snapshot of the proactivity in August. There's a fair bit of detail in the next one, particularly around the rural task force, but it gives some sort of a really good understanding of some of the work that the rural task force has been undertaken. Which has really again been supporting the sort of the whole sort of pandemic response. So there's a lot of detail within that, but again, it just hopefully provides some sort of assurance that activity within that has been maintained throughout.
So we're having separate conversations around the rural task force at the moment. We've had some feedback from the public, particularly around, for example, hair coursing, that there are areas of the county where there's significant issues and people are feeling really scared. So I think that's an issue. And also we've had a couple of members of the public talking about perhaps possible changes to the way in which the rural watches are being involved with policing, again, feeling that that some of that has just gone off the boil a little bit. So there's some elements of this I think that we're just sort of digging into a little bit behind the scenes to try and get some wider questions sort of answered, really.
Okay, thank you. So just moving on to force control room, we explained about the challenging and times that we had in July, and we set about pulling together an action plan to improve our performance. So in August, we saw similar levels again, which kind of again correlates about demand going back to normal in relation to 999 calls. The speed of answer did improve, but not to kind of where our ambition is to reach our target around 10 seconds. Although I can say it has improved significantly in September, which we'll be able to bring to here next month. And also we are going in the right direction in relation to that speed of answer. The most promising, encouraging improvement was in 101 in August. So again, it just demonstrates that the action plan that was put in place, again, it is a credit to our force control staff as well, that we made significant improvements compared to July to ensure that we were answering calls much quicker again. So we were around 2.24 on average speed of answer. We do know again that the call durations are lasting longer, although taken into account there's still been a sort of a decrease in incidents compared to last year. So there's a number of factors performance has improved in August, and in September it has improved yet again. So again, the measures that we put in place and the plans that we put in place have worked.
Okay, so that is really, really good to see. So thank everybody for all of the work there. We will need a more detailed report, I think, for the police and crime panel in October. But also, I suppose I do find it a little bit frustrating that we get to, this seems to go in cycles.
I know.
We sort of performance sort of gets away from us a little bit, and then we have a new action plan and we get it back under control. And I suppose I'm just trying to, a bit of consistency would be, I don't know how we improve that consistency.
So the long term is that we were fully established. So we had enough people to meet the demand, and we've had a huge, sort of recruitment drive. in January, we hope that we will have the full establishment of staff to meet demand. It always changes and people always leave for one reason, but that is ultimately, you know, kind of the response. In addition, we are introducing a whole range of changes within the force control room around customer contact, offering different signposting, telephone resolutions. There's various other things that will have an impact on the demand and still being able to provide a really good service within there. So I think that the report that comes to the Police and Crime Panel will take account of all the other activity changes, improvements that's been made. So we will see that consistency that that we all want.
Yeah, I know we all want it. It is a little frustrating because, you know, over the years of seeing this is a pattern really, and it's you know, it's how we sort of anticipate problems, I suppose, that seems to be and mitigate them before they become problems. And what we seem to do is just not be that effective at mitigating the problems in advance and doing it once they've happened.
Okay.
I know that's difficult, and particularly when we've had recruitment and all of the rest of it, you know, which draws people out of the control room and onto the streets, which is a great thing. But I you know, it is a challenge. Phil, I think you want to come in.
Yeah, thanks, Julia. It's just really quickly just to say, I know Annette's working really hard with the force control room team to try and create that sustainable level of service that we're wanting to achieve. But there's also, just as a reminder, the national piece of work that's ongoing around what's the next generation of 101 contact look like for the police service. And I think as well, it's incumbent on us to keep feeding into that national piece of work to ensure that the police service as a whole, because there's challenges not just with us, it's with every force, has the ability to deliver the 101 service that the public need and the one that we're all striving to achieve, really.
Yes, no, I fully appreciate that. I mean, I think there's been some slightly different change in emphasis, I think, from the government around this as well over recent months, which is quite interesting because the previous minister was keen just to keep it very much a policing function, but there was some intimation from the current minister that he might be more willing to look at a wider thing and are thinking about, you know, opportunities of working with our partners. That would be quite an interesting idea.
Yeah, I think so, because when you actually look at the demand, I know when Annette does her presentation to the Police and Crime Panel, it might indicate this, but some of the demand, quite a bit of the demand that we're facing would be better suited going to partner agencies as opposed to the police, and that obviously takes away the capability of our call handlers to deal with it if we've got to take the call, take the information, and then pass to our partners. So yeah, absolutely, I think it's the right direction to go in.
Thank you.
Okay, so the following slide again, it just gives a summary of where we are in terms of the performance. So, and I'll briefly just talk through.
Sorry, Annette, can I just pick up on the cyber point in York there?
Yes.
Is there any kind of illumination you can bring to the increase in cybercrime in York?
Well, it's not just York, though.
Well, it's not just York, but no,
I mean, Selby's
we've got it there in York. But
yes,
well, Selby,
I can hopefully shed light to that. Again, it comes back to how the changes with reporting and recorded, which is through changes with action fraud, and so it is again sort of a change in recording, okay, rather than a true increase.
So why isn't it consistent then, Annette? Because it's gone. Oh no, sorry, my mistake. I'm looking at the bottom of each table and looking at minuses and not reading across. My apologies.
Yeah. Okay. All right. And just moving to the people in terms of recruitment. Mike mentioned that we've done really well, and we are on track, and in terms of all our recruitment for police and police PCSOs, just in relation to sickness, again, we are seeing that reduction in sickness. We have done an awful lot, as again Mike explained before, in providing support to our staff throughout the pandemic. We've also undertaken a staff survey as well. Hopefully we'll be planning another one over the next few months. But we are seeing that, no change within the workforce in terms of that. However, we are really conscious about the next few months in particular, managing sort of the COVID related issues. But again, there's nothing from as an exception from the people information and data.
Okay, just one thing very quickly. I just wonder whether we should start to include the diversity information in this pack. So we had a helpful update at EB this morning around that, and I think we should definitely include that in this pack as far as we can, because we've got partly because we've got a really good story to tell. And again, I'd just like to, I mean, the turnaround in this is amazing. It is fantastic to see, and I just again thank everybody for a huge amount of work, particularly through the pandemic, to keep this on track. It's great work, so thank you. Phil, you want to come in?
Yeah, did you just want me to give a very quick highlight of what that diversity picture looked like from the National Police Uplift Programme, Julia?
Yeah, that'd be lovely. That'd be great. I don't think we've got any more questions from the public, but I did omit one, so I just want to go back to the Whitby police station issue. So yes, but if you could give us that update, that'd be great, Phil.
Okay,
thank you.
Yeah, I'll do that really quickly, and then I'll get off the meeting because I'm actually going to meet the Home Office to talk about the policing uplift. So really quickly. So essentially, where we are as a force in terms of our black and minority ethnic officer recruitment. We are on target by the end of March 2023 to have a representative workforce of 4.7% against a community level of 3.4%. If we continue to recruit at the same levels that we are currently doing, we are one of two forces across the country that are whole black and minority ethnic community measurements, including Eastern European, is already just slightly over what our black and minority ethnic community representation is. So we are currently sitting at 3.7%. So one of two Home Office forces to achieve that at the moment. With regards to gender, again, we are one of 5 police forces across the country whose average over the last 3 months for recruitment of female police officers is over 50%. Which is fantastic for us. And again, if we continue on the track that we're going, by March 2023, we'll be just over 42% representation for female officers. Currently, for representation at senior ranks from the Chief Officer team through to Chief Inspector, North Yorkshire Police is 50-50 representation, male and female at senior officer level. So that was just a really quick highlight, and please excuse me because I'll just go and jump into the Home Office now to jump into that meeting.
Fantastic, Phil. Thank you very much, and
Okay.
Well done, everybody. Thank you. Okay. So Annette, are we done? Is that?
Yep, that's it done. Thank you.
Okay, all right. So thank you so much for doing that, and thank you to everybody for attending. I just as if I may just return to the question that I omitted about drugs. Sorry, I'm reading the thing down the side about Whitby. Lisa, are you able to answer the Whitby question?
Yes, Julia, thank you. And thank you for the question from the person that's written into us. So at the moment, we don't have a staff member who can look after our front counter at Whitby as a result of somebody retiring and a recruitment process where somebody did come and join us but has then left for another job. So we've got a vacancy to fill. So firstly, an apology to the person who does want to go to Whitby Police Station and speak to somebody at the front counter. I'm sorry that the front counter isn't available at the moment. It is normally open during weekdays in the mornings. And likewise, you've pointed out on the website, it doesn't very helpfully provide that information to you. It just says that we're closed. So again, we're going to look at that and make sure that it's updated, that it's only temporarily offline as a result of staff recruitment, and it will normally be open weekday mornings, and we'll put the opening hours on the website when we've got it back up and running. However, that doesn't mean that you can't physically come to the station and see an officer or a staff member. I know you've had difficulty getting through on 101, and as you've seen from the presentation, there are improvements there that we're looking to make with 101, and it is a cyclical issue with staffing, again, of recruitment and people leaving, and us trying to deliver that consistent service. But there is, of course, a callback facility on 101, so if you can't wait on the phone for it to be answered, please press the callback on Q Buster, and somebody will ring you back on the 101 number if you need to speak to us. So if you need to see somebody at Whitby Police Station, please either call us, email us, get in touch with us, and we can arrange for somebody to meet you there at a specific time if you need to speak to somebody. We do also have a policy of if we're in, we'll come and answer the door. So if you press the doorbell and an officer or staff member is in the building, they will be able to come and answer the door and speak to you. But of course, if they're out on patrol in Whitby or the wider area, they might not be there to answer the door. So please, if you want to come and see us at Whitby, there will be an opportunity for you to arrange to meet somebody there or contact us in a different way. And thank you for your question.
Okay, thank you very much. So I think that is it for today. I'd like to, it's 1 minute past 4, so I'll draw it to a close and say thank you to everybody for all your hard work and support, particularly over the pandemic, which has been tremendous in North Yorkshire. So thank you very much indeed.
Thank you.